Bismillahirrahmanirrahim. Hi everyone. The fourth core competency is relatively straightforward, which is a practice-based learning and improvement, and this is what we're going to talk about today. Okay, so the first sub-competency is evidence-based and informed practice. So hopefully the resident will be able to move from level 1 when he or she is able to demonstrate how to access or identify evidence-based guidelines, and can categorize and analyze clinical evidence with guidance and some help from his peers and his attendings, to level 4 and 5, where he or she can apply evidence even in the face of uncertainty and conflicting evidence to guide care tailored to the individual patient. So basically, teaching evidence-based medicine is becoming really popular now, and I believe almost every single residence program teaches that to its residents. That includes the journal club, and I really advise all the residents to pay attention to that and try really to take the most out of it, out of every single journal club that they will attend. And when they read the article, they try to pay a little bit more attention to the method section rather than the conclusion, and try to go over the terms that they see every now and then and all the time, and try to understand these terms, because basically this is, I believe, method is really kind of the main thing that about most of these articles. You really want to know how the study was done and whether that methodology was really solid or not, and what are the pros and cons for each methodology that was used in the papers. So pay a little bit more attention to the journal club. Again, I think this is something that most residents, they don't really care much about, unfortunately, and they just jump into conclusion in an article and use that as their evidence. But you have to know the hierarchy of evidence and which method is better than which and why. So that's really important. And then there's a lot of resources. You really have to seek help from your seniors and from attendings to know what are the resources, evidence-based resources that are available for you in your program. UpToDate is very popular. It's a very useful and helpful resource, and I believe probably all the programs have access to UpToDate for the resident, but honestly there's a lot of other resources that as equal or even better, in my humble opinion, that can provide you really good evidence, including, of course, the actual medical society guidelines. So keep that in mind. There's a lot of resources. At the beginning of your internship, ask about these resources, be familiar with them, have them in your cell phone so that you can access them really quick during your daily work. And then remember always to manage the patient, not the guidelines, right? Always try to tailor the guidelines to your patient. I think that's really very important. You always have to consider the strengths of the recommendation, and always have to consider the patient's circumstances and whether these guidelines can be applied safely and effectively to your patient or not. So that's really important. I can't emphasize that more. Tailor the guidelines and management according to the situation of your patients, and that entails knowing your patient really well. So that's really key. A very strong resident and intern is the one who seem to know their patients really well. And the second sub-competency is reflective practice and commitment to personal growth. So at the beginning of their training, resident should be able to accept responsibility for personal development by establishing goals and identify factors that contribute to gaps between ideal and actual performance. And then by the time of graduation, they should be able to seek performance data consistently with adaptability and humility, and challenge their own assumptions. Independently also should be able to independently create and implement an individualized learner plan. So multiple things have been mentioned here. So basically, the bottom line, I will advise every single one of you is to seek feedback. It's very important that by the end of every rotation, try to seek feedback from your peers, from your senior, from the attending, and it would be good if you can actually make them aware at the beginning of your rotation that you will need some feedback from them. If giving feedback is not already a common practice, and it should be in the program. And then always do like a self-reflection on daily basis, on weekly basis, on monthly basis about your performance and the cases that you have seen. And also, again, not just seeking feedback, but also giving feedback. If you are PGY 2 or 3, second year, third year, it's very helpful for your intern to sit with them and give them some constructive feedback in a very professional manner. The same also for your medical students, if you are intern. That's really very helpful. And then seek a mentor. Most of the programs nowadays, they assign a mentor for each resident. If that's not the case, be proactive and ask for a mentor, someone that you can trust, someone that you can relate to, and someone you can you think they really have a good and reasonable experience, and they can guide you through your residency training journey. And always have a SMART goals. SMART stands for specific goals, measurable goals, achievable goals, relevant goals, and timed goals. Timed meaning you say, for example, by the end of this rotation, or by the end of this month, or by the end of this year, I should be able to achieve so and so. And these so and so goals should be specific, should be measurable, should be achievable, and should be relevant to the rotation that you're doing. So I think I talked about that in the expectations for the inpatient rotations, but it's I think it's very reasonable to mention that here as well.